Hello everyone, welcome to the M3 Academy. Yes, in today's session, memorization technique and secrets, how to remember everything forever. Yes, so please comment about audio visual so we can start the session. Yes, please join the session. We will discussing the total aspects of the memorization during the NEET PG preparation. Aspects of the memorization. Yes, is audio visual is clear? Is there any echo? Please comment about the audio visual so we can start the session. Yes, yes, Dr. Malika, everything is clear. Yes. So in today's session, we are discussing about the memorization techniques. Yes, so we can start. So first step of the anything remembering. So first step of remembering anything is the higher motivation. You have to keep yourself motivated, and your mental status is high. Your motivation level is high. For this, you can visualize yourself what you do, why you starting this preparation. Yes, you have a strong why, you have reason, you have a strong reason why you are doing the preparation. Yes, you have clarity of the purpose, and you have one strong reason why you are preparing. You have one strong reason why you are preparing, and you have positive affirmation. You have to visualize yourself after the examination in the future. If you have your strong visualization, strong why, and you have a strong question why you are preparing, then you can remember. This is your first step. If you are not having any motivation and you are studying, obviously your confidence level is down, your attention focus is down. So the basic step is, first you have to motivated, you have strong why you are preparing, you have one strong reason what you are doing after the examination, what you are becoming in life. Yes, so you have positive affirmation, you have to strong visualization. Yes, see yourself in space, see yourself after the examination, see yourself after a good rank, after your achievement. So your first step is to maintain your motivation, to make yourself motivated. Yes, so this is first step. Now second, so this is the first step. Stay motivated. Stay motivated. If you have enough motivation, then you can start anything. You have proper attention, focus, concentration, less distraction. Yes, many of you are saying when you are opening the YouTube, you are distracted. Why you are distracted? You are distracted because your aim is not high. You are not enough motivated. You have not strong enough why. Yes, you have not a strong question why you are preparing. If you have the strong question why you are preparing, then you will not get it too distracted in anything. If you are attending the YouTube session, your distraction not happening to any serial, any movies, any things, because if you have high motivation. So please clear that point. Please write on the paper why you are preparing, preparing, what is the one strongest reason for your preparation. Yes, if you have the answer, if you have the strong answer behind this, you are not distracted. You are not distracted. Yes, so first step is stay motivated. First step is stay motivated. Yes, now, so next step is proper environment. Yes, you can see in the diagram also. The next step is proper environment, your proper posture. Yes, your proper environment, proper posture, proper study place. Yes, yes. If you are studying in lying the bed, if you are studying while doing other things, your mind is not there, then it not helpful, आप कोई सा भी चैप्टर पढ़ो, यदि आपका माइंड वहां पे नहीं है, यदि आप लेटे लेटे पढ़ रहे हो, आपका पोस्टर सही नहीं है, सराउंडिंग सही नहीं है, आपका ध्यान कहीं और है, आप दो चार काम करते हुए पढ़ रहे हो, तो आपका अटेंशन फोकस कंसंट्रेशन उतना मेंटेन नहीं हो पाएगा. यस, so you have proper posture, you are sitting on the table, your eye seeing on what you are studying, and your mind thinking what you are seeing. Your mind get the picture what you are seeing. If you are studying the picture of the, yes, if you are studying the picture of the anything, if you are studying the picture of the platelet disorder, and your mind are thinking the another subject. Yes, if you are seeing the dermatitis herpetiformis picture, and your mind are thinking of the another chapter, another other subject, then it is not useful. If you are attending this session, your mind must be thinking about this प्रोसेस ओनली। तो जो आप देख रहे हो वही आपके दिमाग में आना चाहिए, जो आप देख रहे हो वही आपके दिमाग में आना चाहिए, उसी का पिक्चर आपके दिमाग में आना चाहिए। यदि आप नोट्स में देख कुछ रहे हो और आपके माइंड में आ कुछ रहा है तो ये भी हेल्पफुल नहीं होने वाला है। इसका मीनिंग है कि आपका अटेंशन फोकस कंसंट्रेशन उतना नहीं है, आपका अटेंशन फोकस कंसंट्रेशन उतना नहीं है। सो फर्स्ट स्टेप यू हैव टू कीप योर सेल्फ मोटिवेटेड, सेकंड स्टेप यू हैव टू ए प्रॉपर स्टडी एनवायरनमेंट, proper study posture, yes, proper study environment, proper study posture, and so it make you comfortable for the studying. It increase your attention concentration and the focus, it increase your attention concentration on the focus. Yes, Dr. Malika is asking distraction ka solution. I already say, if you have strong motivation, if you have one strong reason for your preparation, if you have one strong reason for your preparation, if you have higher purpose, positive affirmation, if you visualize yourself after your good rank, then you will not distracted, then you will not distracted. Yes, यदि आपको थोड़ा सा डिस्ट्रैक्शन होने लगेगा, आपको याद आएगा मुझे क्या करना था, मैं why I am wasting the time. Yes, if you are thinking, even if you are thinking about the distraction, your time is wasted. You can utilize this second, this minute in solving the MCQ, and if this one MCQ come in examination, you have advantage of the 4 marks, means you have advantage of the thousands ranks. You will realize after the result, you will not realize at this time, you will realize after the results. When you see at the same number, if you get the number 649, there is 100 of these students at the 649 marks, then you realize what is the importance of 1 marks. I'm not saying the importance of the one question, there is the importance of the 1 marks, because at the same marks there are so many students is there. So if you are thinking negative, if you are thinking distracted, if you are thinking anything other than the study, yes, you are in just investing, just you are wasting the time, nothing else. You are just wasting your time, because if you are thinking negative for 5 minutes, you are wasting your 5 minutes. You can do five multiple choice question, you can see five IBQ, you can learn five pearl. Yes, and this if this come in examination, you have advantage of the five question means 5 into 4 20 marks. Yes, your rank differ in 2000, 3000, 5000, but you will not realize, you are not realizing at this time, you will realize at the time of the announcement of the result. So please careful, please careful. Somebody say motivation happened to me in brush, then go into distraction, coming out into the distraction, back into normal track looks difficult. Any solution? So you have to write in the paper. Yes, you have to write in your paper. आपको एक पेपर पे लिखना पड़ेगा. Yes, you have to write your motivation on the this paper. Yes, so you have to take this piece of the paper and you have to write why you are preparing. You have to write your goal, why you are preparing. Yes, you have one strong why. You have one strong question. You have to your positive affirmation. Yes, if you want to become a surgeon, you will draw your photo in type of the surgeon. Yes, if you want to become anesthesiologist, you will draw your picture as the you are anesthesiologist giving the lumbar puncture or anything. Yes, and you have to one strong why you are preparing. Yes, and keep this photograph, keep this page on your study table, so when you feel the distraction, you will see this photograph and you feel the motivated. Yes, everybody clear about this now? So phone addiction because of the apps, phone addiction because of the app, I already say, if you have a strong motivation, why you distracted, जो आपको पढ़ना है वहीं आपको ध्यान देना है. Yes, in the GT too many question, in the GT too many question, one MCQ has the four options, one MCQ has the four options, and if you are distracted toward the all the four options which are not correct, so if one MCQ has the four option, one is correct, three is incorrect, if you distracted toward three incorrect options, so tell me how you correct that, how you can correct that question. Yes, so you must have your attention toward the correct, toward the right choice. In this way, if you are opening your mobile, if you are opening this your mobile, you have to have idea, you have to correct choice in your mind which app you have to open. Yes, you have to open that app, that QBank only. You are not opening that other app. Yes. यस, सो ये आपको क्लियर होना चाहिए कि फोन खोल रहे हो तो उसमें क्या देखना है, ये चीज यहाँ भी हेल्प करेगी। यदि कोई एमसीक्यू सोल्व कर रहे हो तो उसमें कौन सा ऑप्शन सही करना है, यदि आप वहां भी कंफ्यूज हो जाओगे, सारे ऑप्शन में घूमते रहोगे, तो आपको फायदा नहीं मिलने वाला है। सो फोन एडिक्शन only resolved when you have positive affirmation, higher purpose, clarity of the purpose, one strong reason. Yes, this phone addiction only resolve when you have positive affirmation, higher purpose, one strong reason. Yes, when you visualize yourself after the announcement of the result and you can give positive reinforcement of the yourself, you can reward yourself. If you are not touching any distracted app, if you are not touching any distracted serial or anything else, then you can reward yourself. Yes, you can punish yourself, you can both the things you can do. Yes, so this point about the phone addiction. Yes, so first step for the memorization to have strong motivation. Second step, proper study environment, table, proper posture. Yes, quiet environment. You have to strong focus. You have to strong focus. Yes, third thing is the better study schedule. Yes, you will not overcome your study schedule. Yes, if you make the study schedule, morning mein you have to do cubing, evening mein you have to do attend session, night mein you have to revise the notes, then please do not disturb your schedule by any other activity. Do not disturb your sleep. Yes, the consolidation of the memory happening in your sleep, so you have to take adequate sleep as the minimum 6 to 7 hours. If you are not sleeping properly, your attention focus are not maintaining properly, then your memory obviously affected. Yes, and you have to take your time for the physical exercise. At least 30 minutes you have to doing walking exercise, gymming, dance, anything recreational activity you have to involve. This regenerate our new neuron, this regenerate our new neurons. Yes, so these are the basic steps, but these are the important. Yes, adequate sleep is important, sleep hygiene is important. Yes, if you are thinking about your result, if you are thinking your time wasting in sleep, this is not helpful. You have to maintain your sleep hygiene, proper timing of the sleeping, proper awakening from the sleeping. Yes, you have to also involve your time in the physical exercise, in walking. Yes, and you have to strong motivation. Adequate sleep for those who can't sleep because of the anxiety. There is no point of the anxiety. I already say, if you are wasting your time in anxiety, if you are wasting your time in thinking of the negative things, if you are wasting your time which is not in your control, if you are wasting your time which is not your in control, you are just wasting your future. You are just wasting your future. Yes, if you invested 30 minutes in anxiety, if you are invested your 30 minutes in thinking of the negative, you are wasting your 30 minutes of the 30 MCQ equal to 1 mini test, one mini session you can attend at that point, and you have advantage of the 30 marks. Yes, your rank will be differ in the 2000, 3000, or 4000. Again say, you will realize after the announcement of the result. Yes, you are not realizing at that point. So एट दिस टाइम यू हैव टू यूटिलाइज योर एवरी सेकेंड। हर सेकेंड में आपको सोचना है कि इस टाइम में मैंने कुछ और सोचा भी तो मेरा क्वेश्चन का टाइम जा रहा है, दूसरे बच्चे मेरे से आगे निकल रहे हैं। यस, एग्जाम इज पोस्टपोन्डेड, मेनी इंटर्न हैव गेटिंग द टाइम। यस, सबको टाइम मिल रहा है, यहाँ पे सबको बराबर टाइम मिल रहा है। इफ यू आर वेस्टिंग योर टाइम इन थिंकिंग ऑफ द एंजाइटी नेगेटिव और व्हाट, मेरा क्या होगा क्या नहीं होगा, तो इस सब में आपका टाइम जा रहा है। उस टाइम में आप कितने एमसीक्यू कर सकते थे, कितने सेशन अटेंड कर सकते थे, कितने नोट्स पढ़ सकते थे, कितने मार्क्स अर्न कर सकते थे, ये सब आपका यहाँ पे बेकार होता जा रहा है. सो यू शुड बिकम ग्रीडी इन द स्टडिंग. यस, यू शुड हैव द ग्रीडीनेस. आपको थोड़ा लालची बनना पड़ेगा कि टाइम मुझे कहाँ लगाना है, टाइम मुझे कहाँ नहीं लगाना है. यू हैव टू बिकम ग्रीडी इन मैटर ऑफ द टाइम सेविंग, इन मैटर ऑफ द टाइम सेविंग. यस. So is Dr. Malika clear about this? So three step of the strong memory: have strong motivation, have proper study environment, have adequate sleep, have adequate sleep. Now fourth step is you have to prioritize your content. Yes, when you studying any type of the chapter, yes, if you are studying the pharmacology, you have to prioritize the chapter which things ask most in the pharmacology. Yes, you cannot start from the first chapter to last chapter. Yes, you cannot start from the first word to last word. You have to prioritize the subject, you have to prioritize the content, you have to prioritize the topic. You cannot start from first to the last. You can start from the first chapter to last chapter, first word to last word, first sentence to last sentence. Yes, if you are preparing for NEET-PG, you have clear idea in your mind which subjects are important, which subject have high weightage, which subject are making 30-40% of the paper. Yes, OBG making the 30%, 30-40% of the paper. Yes, surgery is making, yes, PSM is making. Yes, and if you are investing your 1 month in short subject, and if you are investing your 1 month in long subject, then this is not helpful, because every subject has different weightage, every subject has different weightage in the examination. Yes, so you have to prioritize your subject, you have to prioritize your chapter, you have to prioritize your topic. Yes, so you should start your study from the higher weightage subject, from your weakened subject. You can use your common analysis, which is your lowermost subject, which is your top most weak subject. Yes, if your top most weak subject is OBG, and OBG is high yielding, you can start from this subject, you can start from this subject. Yes, and is OBG, then you can take which topic are important. If you are studying the pharmacology, you have your clear mind idea in your mind that 50% of the pharmacology paper is from antimicrobials, जनरल फार्मेकोलॉजी एंड साइकोफार्मेकोलॉजी. यदि आप फार्मेकोलॉजी पढ़ रहे हैं तो आपके माइंड में होना चाहिए तीन जगह से क्वेश्चन आते हैं. मोस्ट ऑफ द क्वेश्चन फ्रॉम द एंटीमाइक्रोबियल, देन जनरल, देन साइकोफार्मेकोलॉजी, देन रेस्ट ऑफ द फार्मेकोलॉजी. So you have to prioritize your subject, you have to prioritize your topic, then you have prioritize the content in the topic. Yes, if you are studying the antimicrobial, you cannot start from the first line to last line. You have to prioritize which the examiner is asked. So first look at the non-texted information written in the notes. Yes, while starting any chapter, you have to look at the index, at the index of that chapter, at the heading of that chapter, at the images, at the flow chart. Yes, at the images, as the flow chart, at the tables. Yes, then you look at the text. Yes, when you look at the table, when you look at the table, any comparatively table, you can finish your two chapter, you can finish your two topics at a time. Yes, if you are covering any table, the difference between apoptosis and necrosis, you can cover two chapter, two topic at a time in the differentiating manners, because in examination multiple choice question, they are mainly asking the differences. So please start your subject with priority, start your chapter with priority, start topics with the priority. See the images, the tables, the flow chart, schematic diagram, then goes to the theory. Yes, so third step is prioritizing the content. Yes, you can use for prioritization your common GT analysis, top most weekend subject, and most high yielding subject, most scoring subjects. Yes, this is clear to you. So this is the four most important step effective for the effective memory. Next, so next step is to quantifying your study hours book. Yes, what is this study hours book? What is your study hours book? If you are studying any subject, any topic today, you have to write down in the paper while before the sleeping. Yes, सोने से पहले आपको एक छोटा सा डायरी लेनी है, उस डायरी में लिखना है आज की डेट और आज आपने कौन कौन से टॉपिक पढ़े. Yes, before going to the sleep you have to make a small diary. This diary name is study hours book. Study hours book. Yes, you can just note down the date. Today's date is 15 February and you have studied the subject pharmacology, psychopharmacology. In medicine you cover, you finish the murmur. In the physiology you finish the graphs. And yes, and next day before sleeping, again you are writing with date and the topic. Again third day, again date and the topic. So आज दिन में आपने कौन कौन से टॉपिक पढ़े वो आप उसमें लिखते जाएंगे. Yes, and this helpful for your space revision. This is helpful for your space revision. Yes. So क्या करना है, you have to revise. What is a space revision? You are revising your content in the different intervals. You are revising your content in the different interval. Yeah, like you have to cover any topic today, you have to revise on the third day, you have to revise on the seventh day, you have to revise that content on the 13th day. So if you do space revision, that content will be helpful. But how you know what you have revised, what you have studied 3 days before? How you know? So by you are knowing by this study hours book. If you are making study hour book regularly, yes, if you are making this study hour regularly, how you can make study hours book? Just note down the point before going to the sleep. Just note down the name of the chapter, name of the subject, name of the topic which you studied in that day. Yes, so on third day you just flip the pages what you studied 3 days ago. Yes, and just do revision. And on seventh day just see what you done 7 day before. On 13th day what you studied 13 day back. So you can easily do. Yes, and you have to proper allotted time for the revision. You have proper allotted time for the daily revision. Daily at least 1 hour for the revision. Daily at least 1 hour you can give for the revision. In this period you can open your study hours book and you can revise the 3 day earlier content, 7 day earlier content, 7 day ago content, and the 30 day earlier content. So this is the helpful for the your revision. So what is the step for the memorization? First you have the strong motivation, then you have proper study environment, proper posture, proper attention focus, then you have adequate sleep, proper study schedule, then you have to prioritize your content, your topic, your subject. Then you have to make study hour book and daily revision book. Study hour book and daily revision book. Yes, everybody clear about this? Yes, if you have any question you can ask in the chat box. If you have any questions you can ask in the chat box. Yes. Now, so next thing come how to study, how to read the notes, how to read the notes. So next the next thing is how to read the notes. So while reading the notes you have to use your five senses. Yes, while reading the notes you have to use your five senses. Yes, while studying you have to use your eyes, your ears, yes, your tongue, your hands. If you are using your multiple senses, the information going to your brain by multiple pathways and it help to multiple integration. Yes, multiple ways the information goes going to your brain, so it has a strong memory. It help to making the strong memory. Yes, so don't just attend the session, please note down the session, please speak the session. You can speak loudly the session what the faculty is teaching to you. Yes, you have to note down in your copies, note down point in your copies. You can speak, so your tongue is working. Yes, you are listening, so your ear is working. You are writing, so your hand, your such receptor is working. Yes, and you are seeing, so your eyes are the working. And if you are feeling that thing, if examiner are telling you bishop score, then you can feel the environment of the labor room and different type of the position. If you are visualizing that things, then you can make your third senses. So if you are using your five senses, your multiple senses, the information goes in different things. Yes, and don't just study, you have to use your fingers. You have to your index fingers. Yes, यदि आप कोई चैप्टर पढ़ रहे हैं तो आपको उस पर ऐसे फिंगर चला चला के पढ़ना है. यस, यस, यदि आप कोई भी पैराग्राफ यदि पढ़ रहे हैं, इफ यू हैव स्टडी एनी पैराग्राफ एनी टॉपिक, यू हैव टू you have to keep your finger on the words. You have to keep your fingers on the word. It is helped. This help you on keep. This help keep you on the track. This help you on keep on you on the track. Yes, if you if you are putting your finger on any word, your eye is seeing any word, and you are just thinking that word only. You are not thinking anything else. So this increase your attention, this increase your focus, this increase your concentration. So this is easy technique. If you are not using this, this is known as the index finger technique. This is known as the index finger technique. So use your five senses. Use your five senses and convert your theory in the mind map. Yes, convert your theory in the mind map. Yes, if if one thing has a two type has a four type has a five type, so you can just make the flow chart. Yes, यदि आप पढ़ते जा रहे हैं यहाँ पे कि ये एक चीज है, इसके दो पार्ट होते हैं. यस, इसके फिर दो पार्ट होते हैं. इसके दो पार्ट होते हैं. इसका आईओसी ये है, इसका डीओसी ये है, इसका जीन ये है, इसका सर्वाइवल ये है. सो यू कैन कन्वर्ट योर थ्योरी इन द माइंड वेब. यस, इफ यू आर कन्वर्टिंग योर थ्योरी इन माइंड वेब, इट यू हैव टू डू ए एक्सरसाइज. इसमें आपकी एक एक्सरसाइज हो रही है. और while making the mind map, the information goes concise, goes schematic, yes, non-textured information. So you can look at the chapter at a glance at end of the study. Yes, so please convert your theory to mind map while reading your notes. Yes, and you can use multiple colors. You can use various colors plain to highlight your note. This can filter your content. This can make your notes most attractive. Yes, we already discussed what is the purpose of study today. The purpose of study today is to filter the content. What is important for the last month revision, what is important for the last 15 days revision, and what is important for the last 5 days revision. Yes, purpose of the study today is only filtering the content. If you are not filtering the content at the end of the days of the examination, you cannot filtering your content. You cannot know what you have studied. You have to bulk of the notes. You have to bulk of the notes. How you revise that bulk of the notes if you are not filtering your content? What you will revise in last 15 days, last month, and last 5 days? Because our syllabus is memory based, our syllabus is factual, our syllabus is most of the ratification, most of the रटने वाला information. So our syllabus is just the factual, just a number, keyword, and factual information. So if you are not filtering, you will forget for sure in next 2 to 3 months. So you have to filtering your content. And how you can filter? Just you can use your GT analysis. You can open any GT and you can opt the subject wise filter. Wrong question, those topic you make wrong, please mark as the last 1 month. If you are making again that topic wrong, you can mark that subject, that topic as last 15 days. If you are keep making the repetition, you are keep repeating wrong days topic, then you can mark as the last days. Yes, if you look yes, and if you have your forgettable volatile content collected for your last 5 days, and you have looked at last 5 days your forgettable or volatile content, you can get your extreme high accuracy and speed in examination. Yes, you have to clear this point. In examination you have seconds of the time for the solving the MCQ. You have the seconds of the time. Even you have not getting the time for the proper reading the question, proper reading the question, or proper thinking about the question. So you have high accuracy, high speed. How your accuracy speed is increases? When you revise your forgettable, when you revise your volatile point at the last 5 days, when you revise your forgettable, when you collected, when you filtered your content for the last 5 days. How you filter when you are attempting your GT, when you are attempting your mini test, subject wise test, those question you have marked wrong, please mark that topic as last month revision. If you are keep making wrong that topic, you can mark that last 15 days, last 5 days. Yes, जितने भी score criteria, yes, those score criteria, staging numbers, yes, you can mark for the last 5 days. last 5 day, and you also making the photograph of this, you also capture the photograph of that forgettable and send to your own telegram group, make your own telegram group, subject wise group, and post there by the caption, post there by the caption. So if you are not having book in your duties, or you can say at the examination hall you are traveling, if you are not having your notes, not having your books, you can revise from your mobile also, but you have to collect the picture of your forgettable and you have to post, you can make the different galleries and you can make the your own telegram group. Yes, what to do about many क्या कहा यहाँ पे? Yes, Dr. Malika, what are saying? What to do about too many apps? Please tell how to manage all. So you have to focus on topic. Do not focus on the app. You have to focus on the topic in every edge, in every app, every platform. There is a common topics. Yes, every platform, every coaching, every faculty is teaching the same topics, same subject, nothing different. Just the way is different. Just the way teaching method is different, topic is same. Examiner not asking you from where you study, exam is not asking you from where you study your this topic. So if you have mastering your topic, if you solve all the question correctly from their topic, no need to trap in any FOMO. The platform you have, the app you have is enough. Yes. Yes, the platform you have or the app you have is enough. So we are talking about the write notes in various colors. Yes, now the next step is organize and concising the content. If you have the bulkier content, your interest is lost for the study. If you have concise content, if you have organized content, your interest is increasing for the studying, your time is saved in revision, your time is saved. So you have to organize, you have to concise your content. Please reduce the number of the pages of the your notes. And the next method of the memory improvement is quiz yourself. So if you are studying any topic, if you are studying any the if you are studying the BIRATs, or if you are studying any studying classification, scoring, drug of choice, just ask your question. Just make the question on the different pages. Yes, क्या करेंगे आप यहाँ पे? So while studying any chapter, you just take a page, you just take a page and make your question yourself, make question yourself. Yes, if you are studying the color of the hypostasis or PM staining, so while studying, just make what is the color in carbon monoxide PM staining. Yes, what is the difference between freshwater drowning and the seawater drowning? Yes, you can write. So you can make the question. Please keep putting question in separate pages, and after covering that chapter, please look at these questions and again speak the answer yourself. Again, speak the answer yourself. So this thing is quizzing yourself. So while study the notes, you have to make question on the different papers. You have to make questions on the different paper. After finishing that chapter, you have to ask yourself this question. So if you are asking yourself the question, you can review what you have remember, what you have not remember. This helpful in your active recall. Yes. So everybody clear about this? So this is the this is the quiz yourself, and also you can hiding the content by your fingers. Yes, you can hiding the content like drug of choice for this fever. You can hiding the content and you are speak. इसका क्या था, इसका क्या था, इसका क्या था, ऐसे आप यहाँ पे फिंगर से हाइड करते करते भी याद कर सकते हैं. This is quizzing yourself and active recall. Yes. So everybody clear about this? How to study the notes, how to study the notes. So you have to prioritize the content, you have to using the different colors, you have to filtering your content, you have to organize, concise, and you have to quiz yourself, active recall, and writing it out. Yes, next step is writing is out. Next step is writing is out. Yes. सो इफ यू आर स्टडिंग द एनाटोमी डायग्राम, यदि आप एनाटोमी के डायग्राम पढ़ रहे हैं और आप उसको केवल पढ़ रहे हैं तो वो आपके लिए फायदेमंद नहीं होने वाले हैं. इफ यू आर स्टडिंग द एनाटोमी डायग्राम and you are just seeing the diagram, you are just seeing the diagram, it is not at all helpful. You have to draw that diagram in your notebook. Yes, you have to draw that diagram. I already say, please, I already requested you, please draw, please make a habit of drawing 5 anatomy diagram daily. Yes, examiner are asking question about the relationship of the anterior part of the kidney, the relationship of the third part of the duodenum, what is the anterior relationship, posterior relationship. Examiner are asking the branches. Yes, examiner are asking the branches of the contents. So how you remember? How you remember? So you have to draw that things. You cannot learn by the seeing the picture. So you have to draw yourself. Please keep the habit of the making 5 diagram daily. So you have to make your habit to study 5 diagram daily. So yes, so writing is out. Everybody clear about this? Writing is out. Everybody clear about this? Yes. So if you have any question, you can ask in the chat box. If you have any question, you can ask in the chat box. Yes, I will answer in between. Yes, so writing is now out. You have to write the anatomy diagram, not just sing. केवल देखने से anatomy नहीं आएगी आपको. You have to write. Yes. Now, next thing is daily reading. You have to daily revise your content. Yes, if you are not getting time for the a day has 12 hours, 24 hours, and if you are time wasted 10 hours and if you are getting only 2 hours, yes, then you are not thinking my 10 hours is wasted, my most of the time is wasted, I cannot study in day, I cannot attend it, I can't attend it the session. In spite of this, you have to thinking like I have got the 2 hours, how you can, how we I can utilize every second of that 2 hours. Yes, so please make the habit of daily reading. Even you, if you are getting only 1 minute, you have to utilize that 1 minute. You have to positive mindset, you have to growth mindset, that if you are getting even 1 minute, you are utilizing, you are not thinking your most of the time wasted, you are thinking how you can utilize that minute. Yes. Now, this is the few point about the how to study their notes for proper memory. Now, the next point is how to boost your memory. The next point is how to boost your memory. If you cover any topic, any subject, then if you want to know you have strong in that chapter or topic or not, so you can teach that topic someone. You can teach that topic someone. So next step is teaching. Teaching someone or discussing with the friends. Teaching someone or discussing with the friends. So when the faculty teaching you any subjects, faculty remember 90% of the content and the student only getting 10% of the content, because faculty are actively involving in the teaching. Faculty are speaking, faculty are writing, faculty are thinking, faculty are solving your doubts simultaneously. So faculty have active participation, active involvement, but students have only passive involvement, that they are getting only spoon feeding. So they are getting only 10% of the content, they are getting 10% of the content in their memory, and faculty have 90% content of the memory. So if you have finished any topic, any chapter, any subject, if you are teaching your friends, if you are teaching someone who not know that topic, and if they say they you are explaining very well, if they are understood very well, then this topic, then your topic is strong, then your topic is strong. So do not afraid that if you are start teaching your friends, your competition is high, because if you are start teaching your friend, you got command 90%, you will got command 90% on your topic, and your friend get only 10%, because one who teaches the subject that have active participation and that got the 90% command, 90% grasp of that topic. So you can teach your weak friends. Yes, you can teach your friends who are weak in any subjects, yes. So teaching someone is really helpful, and you can start discussing with your friend. Yes, you can utilize the telegram discussion on the fixed time. Yes, you can start discussing the topic with your friend. Just take like you are just taking the murmur and just asking the question with your friends. Yes. Now, next thing is weird linkage. Next thing is weird linkage. So our mind has the tendency we study only things which we have comfortable. Our mind has the tendency we study only things which we have comfortability, which we have suitability. Yes. And the topic we feel difficult, topic we feel very bizarre, topic we feel very odd, we not having interest, even we not play, even we not pay any attention to that topic. So we have to create some weird linkage. We have to make that topic easier. Like if you reading the name metronidazole, this is very difficult name. But if you segregate that name metronidazole, metro, if you are relating that with metro, if you are reading sulfonamide, if you are segregating that word like cell phone amide, cell phone, this is cell phone. So cell phone माइंड उस चीज को वहां पे ले लेगा. So this is weird linkage. Yes, and you can use the mnemonics for the proper memory. Obviously, the M3 Academy MCQ meets mnemonics. We already created 3000 mnemonics or of the 19 subject previous year topics, very high yield content. So we already given you many of the mnemonics. You don't have to making efforts on the making the mnemonics. We already given you many of the mnemonics. 300 plus mnemonics YouTube session are available on the YouTube. You can revise. Yes, in our time there is no such platform which are providing the previous year topic in the simpler form, in the easier tricks. We have to make our own tricks, but you have to getting the ready-made material, so you can use that mnemonics, and we are creating the mnemonics in form of the story, in form of the song, in form of the rhyming. Just we are not telling you 1 2 3 4 ABCD type mnemonics. Yes, yes, you can see many story mnemonics. Yes, we have created like UC, the all the feature of the UC you can remember by story of the bad boy, all the story of the all the feature of the Crohn's disease you can study from the story of the good girls. Yes, so many story mnemonic we have created, not just ABCD type mnemonics. And like the hairy cell leukemia, just the term you know here, you can tell everything about this. So you can create your mnemonic, your own mnemonic also. Yes, and yes, and next thing is, so you can do the song mnemonics. Yes, Malathion. Anybody remember the Malathion song mnemonics? Yesterday we discussed the criminal responsibility song mnemonics. So many things we already covered. So next step is the chart on wall. Yes, next step is chart on wall. Yes, so you can make the flashcard. Yes, so how you can make this? Is audio is clear? Please comment about the audio visual so we can proceed. Yes. His audio is clear. Now, chart on wall. So you can make the sticky notes, you can make the flashcard, you can make the study notes, you can make the flashcard of your forgettable points, and you can stick on your study table, you can stick on your front of the your wall, and you can fix your time. Yeah, like before going to the food, after going to the food, before going to the bath, after coming out from the bath, you have to revise 5 flashcard. You have to revise 5 flashcard. Yeah, like you can make the habit before going to sleep. You have to revise. You have to look five flashcard that stick on the wall, that stick on the table. Yes, you can make like this. I can share you photo. Yes, so you can yes, you can take a black. You can take a board also, or you can write on this your flashcard material, or you can stick on your study table. Yes, or you can also write your point on this. types. Yes, you can also write a point on these types. Yes, and just आपको एक हैबिट बना लेनी है कि खाना खाने से पहले 5 फ्लैश कार्ड रिवाइज करने हैं, खाना खाने के बाद 5 फ्लैश कार्ड रिवाइज करने हैं, डेली की आपकी हैबिट बन जाएगी. When you going to the taking for the food, you have to revise 5 flashcard. After coming from the, you have to revise 5 flashcard. So in this way you can revise daily 10 flashcard. Yes, and this helpful for your daily revision. So this is the chart on wall. Yes. Now next thing is poster summary pages or one page summary. So if you are study the murmur, you can do the summary pages. So you can say you have to 19 subject. Yes, we have to 19 subject. We have to 19 subject, and one subject has 19 chapters. And if you are making one page summary for total chapter, you can get the 67 pages, and most of the short subject only having 10 chapters, so you can say only 300 summary pages you have to create. Only 300 summary pages you have to create. So you can make the summary pages for the each chapters. Yes, you can make the summary pages for STD, for bullous disorder. We already make many summary pages, like for arthritis already posted on topic group. You can refer from there also. So you have to make summary pages in which you have to note down only key point, only forgettable point, only volatile, only the numbers, hyper, less than, more than, only this type of the thing you have to note down in the comparatively manner. You can make the summary pages. So if you we have 19 subject, and 19 subject have 19 chapters, so you can say you have around 300, you have around 300 summary pages, and 300 pages you can easily revise 10 pages daily in 1 month. So you can do multiple revision, and while making these summary pages, yes, while making these summary pages, your content is also revised. So you can make the poster or summary pages like one page for STD, one page for murmur, one page for formula, and you can make. Yes, this is very helpful for your concising the material, organizing the content, concising the material and organizing the content. Yes, and how you can convert the bulkier information in the shorter information. This is example. Yes, while you are studying the type of the von Willebrand disease, if you are studying the type of the von Willebrand disease, like if you are studying separately, type 1 separately, one paragraph, type 2 again one paragraph, type 3 again one paragraph, then it have the 3 pages content, 2 or 3 pages content. And if you draw that theory in this type, you can easily, yes, you can easily tell any point. Yes, you can say this is type of the von Willebrand, first, second, and the third. So I just say this is most common, one is most common. Yes, and दोनों के आगे लिख दिया, this is autosomal dominant. Yes, third one is autosomal recessive. First and second, yes, and second is quality defect, and first and third is quantity defect, and first and second are missense mutation. सो कितनी सारी इंफॉर्मेशन यहाँ पे लिख दी. यदि आप इनको अलग से पढ़ते कि टाइप 1 वॉन बिलबान डिजीज इज मोस्ट कॉमन, one line, second is it has missense mutation, second line it is autosomal dominant, third line yes it is quantitative defect, is fourth line. So यहाँ पे 4 लाइनें आपको लिखनी पड़ती, और यहाँ पे 3 चीजें हैं, और तीनों के बारे में यदि आप 5 5 चीजें भी लिखते हैं तो यू हैव 15 लाइन. यस, एंड मेनी और लाइन आर गेटेड इफ यू आर डूइंग दिस. यस, और यहाँ पे यदि आपको निमोनिक से भी इसको रिलेट कर सकते हैं, लाइक 3 पर्सन 1 2 3, दिस 3 पर्सन, द फर्स्ट पर्सन, द सुपीरियर पर्सन इज डोमिनेटिंग ऑन द 2 पर्सन, फर्स्ट एंड सेकंड पर्सन आर डोमिनेटिंग ऑन द थर्ड पर्सन. सो यू कैन से फर्स्ट एंड second type are autosomal dominant, third person are not dominating, so this is autosomal recessive. Third person bearing the weightage of the 2%, you can see this is very difficult situation. So this is severe type of the von Willebrand disease, this get deleted by this weight. Yes, second person enjoying the profit of the first and third, so you can say second person has the bad quality. So you can say this is qualitative defect, first and third is quantitative defect. Yes, so in this way you can cover the bulkier information in the schematic diagram. Yes, everybody clear about this? Yes, so this is an example, and you can also concise your material like photo collage, like all the instrument. You can see all the instruments. Yes, all the instrument in one picture, all the surgical instrument in one picture, and we already discussed all the cancer staging in one picture. All the yes, पहले अपन यहाँ पे देखा है. So you can refer this diagram. All the named surgery in this one picture. So सारी named surgery यहाँ पे एक ही picture में दिखाई हुई है. So you can draw also human body diagram and just note down all the lymph node head to toe, all the scoring head to toe, all the chemotherapy regimen head to toe, all the named surgery head to toe. Yes. So सारा head to toe आप यहाँ पे लिखते हुए चल सकते हो. All the named surgery head to toe in this human body diagram, all the prognostic scoring, all the chemotherapy regimen, all the lymph node, all the things. टोटल आप यहाँ पे लिखते हुए चल सकते हो तो काफी आसानी से आप यहाँ पे इंफॉर्मेशन को ऑर्गेनाइज कर सकते हो. यस, दिस इज क्लियर टू यू नाउ. So how you can do weird linkage like this chart is asked in INI-CET previously. So यहाँ पे पूछा था इनकी चेन को पहचानने का. So यहाँ पे कैसे देख सकते हो अल्फा. अल्फा इज लाइक द wing of the bird and birds are flying on the sky. So topmost line of the graph is alpha. Yes. And gum means दुख में अपन कैसे होते जाते हैं down. So gamma is down chain. Beta means बढ़ता हुआ chain. Yes. Elephant is leading. So elephant वाली आगे आ गई. Delta dog is behind. So dog पीछे हो गया. So in this way we can do the weird linkage. Our ultimate aim. Yes. What is our ultimate aim? Our ultimate aim to mark the correct choices. Our ultimate aim to mark the correct choices. Yes, nobody asks you how you are making the correct options. Yes, nobody asking you how you answer correctly. कोई आपसे नहीं पूछेगा कि आपने आंसर कैसे लगाया. Yes, if you are making the question correct by any mnemonic, any acronym, any correlation, any weird linkage, anything, you don't need to know the concept. You don't need to total theory. But if you mark the correct option, you will get 4 marks. You will get 4 marks. You have advantage of the 1000 rank. Yes, your position is score secure, your rank is secure, your future is secure. So do not afraid about the linking, correlating. Just be greedy about the solving the MCQs. Yes, so we have covered the most of the point for the memorization techniques. Yes, yes. So if you have any question, you can ask in chat box. How to increase sitting hours? How to increase sitting hours? So sitting hours को कैसे increase करना है? How to increase your sitting hours? So you have to develop habit of making attending GT. You have to develop a habit of attending regular GT. Yes, you have to attend. You have to give at least 2 GT per week. Even you are getting negative mark. Even you are getting 0 marks. You have to make. You have to attend the GT, and you cannot. Go away from the GT beyond the 3 hours. You have to keep sit on the place for the 3 hours. 3 घंटे तक आपको बैठे रहना है चाहे आपको क्वेश्चन आ रहे हो चाहे आपको क्वेश्चन नहीं आ रहे हो आपको वहां से उठना नहीं है. Yes, in the 4 of the 5 DT your sitting capacity is increases. Your sitting capacity is increases. So GT we are not giving GT for the scoring for the other things. We have to write GT for increasing our sitting capacity, our concentration, attention, focus. Yes, our reducing the distractions. Yes. सो इन सब के लिए अपन जीटी अटेंड करते हैं. जीटी का पर्पस ये नहीं है कि जो पढ़ा है वही देखना है. जीटी से काफी सारी चीजें कवर होती है. योर एग्जाम फोबिया इज रिड्यूस, योर एंजाइटी इज रिड्यूस. यस, योर सिली मिस्टेक इज रिड्यूस, योर मेकिंग द इनकम्प्लीट क्वेश्चन रीडिंग इज रिड्यूस. यस, जीटी के 2 आवर में मूड फोगिंग होता है. जीटी के 2 आवर में मूड फोगिंग होता है. Yes, so you have to make proper posture while attempting the GT. You have to sit properly. You have to proper environment. You have your higher motivation, and you have to clear thinking that you will You will invest your 100% effort. You have invest your 100% effort of making every question right in your GT. Yes, you are not losing your confidence. You have to confidence that you will mark that question correctly. आपके मन में होना चाहिए कि ये क्वेश्चन मैं करेक्ट करूंगा, तभी आप उसमें कर पाओगे. यस, नहीं तो ऐसा होगा क्वेश्चन पढ़ते ही मन में आएगा कि ये तो नहीं कर सकते. Even you don't know the topic, even you don't know the answer, you have to clear idea in your mind. You have to clear point in your mind that you will crack this question. Yes, first thought in your mind while seeing any question, that I will crack that question, I will crack this question, I will got answer this correctly, I will top this GT. Yes, I will top this GT. Then you can start the reading that question. Then you can start the reading this question. This is your motivation or belief, your confidence will help you to correct the questions. Yes, and if you are thinking I am not getting correct this question, I have revised many time ago. I am poor this subject. I am poor in pharmacology. This question from pharmacology, I am not able to do correct. Then your possibility of the chances, your chances of the correcting question automatically reduces to 50%. So first thing, to believe you are intelligent, you are brilliant. Yes, you are same as the topper, nothing different. You have the same cranial capacity, you have same neuron, you have same neuroglia, you have do same things, you have same cerebrospinal fluid, same neurons which have toppers. You are not having the confidence, yes, belief, trust. Yes, so you have developed your confidence, belief, trust that you can crack the MCQ, you can crack the GT, you can crack the exam. Yes, sitting is a problem. Those who are hyperactive. So if you are hyperactive, you can reinforce yourself. If you are not study in this duration, if you are not realizing this time, if you are not utilizing this time, what is happening after the result? Yes, think yourself. You will not get time for the correction after the examination. Yes, you want a clinical branch, non-clinical branch, or paraclinical branch. How you are assuming your future after the 30 year? Yes, you're the 30, 40, 60 year of the life. How you are assuming, why you are investing this time, why you are not doing the job, while you are not earning, while you are not marrying, while you are not traveling, while you are not watching the movie, why you are wasting your youth? Yes, if you are wasting your pleasurable time, then please invest this time in the quality reading, quality study. Yes. So sitting is a problem. Someone asking sitting is a problem. Those who are hyperactive, so you can reduce your hyperactivity by this reinforcement, by the thinking what is happening at the announcement of the result, what is happening to you when result is announced. Yes, do you want to see your rank in thousand, in lakhs, or you want to see your rank is in 100, 200, or the 500? Yes, just start thinking from now. You will not get time after examination to cover your backlog. Yes, your weekend subject. You have got this time. Yes, so you have to make your proper momentum. You have to make your proper momentum. दिमाग में ऐसा माइंडसेट होना चाहिए कि जब तक आपको सीट नहीं मिल जाती, जब तक आपका एडमिशन नहीं हो जाता, you will not stop. You will not stop until you will keep yourself on track. You will keep yourself on track. Yes. So even paper is out. Yes, if your paper is good, if your exam is going to good and paper is out, the the NBA announce re-examination. What you do? So you will not lose your momentum even after the examination until you are getting the seat, until you are entering your college, until you are entering your residency. You will not losing your momentum because anything happening at the any moment of the time. Yes, that the NEET PG is postponed date just 3 days back, anything may be happening. So you have to ready until you are entering your college. Yes. How to stop comparison also please tell is the last point. So why you are comparing? Why you are comparing? Everybody has a different life, everybody has a different journey, everybody has a different college, different scenario, different family, different. Everybody has a different. So no point of the comparing. Just compare yourself from your past. Just compare yourself from your previous days, what you have not covered. Yes, just compare yourself. Just compare yourself which mistake you did in previous GT, which mistake you did in INI-CET, which mistake you did your FMG, your previous NEET PG. Yes, you are compare you should compare yourself. You have not have to compare with other person, other friends. You have to compare yourself from your previous history. Yes, what mistake you did in your previous NEET PG, you have to compare this point. What subject you are not revised, what mistake you have done. Yes, your mistake is individualized. Your mistake is individualized. Yes, so you have to compare yourself. Yes, you can observe other what they are doing, yes, but you are not comparing. Sir, study with Dr. Claude are asking, sir, I have problem in study a specific topic. I feel like I am taking long time, so I study fast, but I can't recall later. Yes. So study with the Dr. Claude are asking that studying a specific topic taking very long time and when study fast can't recall later. Yes. So you can use the active recall principle. Yes, while studying you can make the while studying any topic you can make the questions like just like you are studying the toxicological plant, you can make the questions. Yes, what is the color of the ratty seeds? Yes, what is the active principle of the castor seeds? Yes, what is the photograph of the digitalis purpura? You keep writing the question, and after reading that, after finishing that topic, you will open that pages of the question, and you are asking question to yourself. What is the color of the digitalis fruit or digitalis leaves, digital is flowers. Yes, and you are answering yourself that digital is purpura, pink color fruit. Yes, abras pecatorius have making for the Swiss. So you have to make the questions along the study, and after the finishing this session you can use for the active recall. You will answering yourself. Yes, and you also make the study hours book. What you have studied today, you have to note down that book, and you revise it this on the 3 day later, on 7 day later, and the 30 day later. Yes. Yes, this method helpful for the this problem. यस, और फास्ट फास्ट तो पढ़ना पड़ेगा, किसी भी चैप्टर में इतना टाइम अपन इन्वेस्ट नहीं कर सकते, वी हैव वेरी लेस टाइम. यस, देयर इज अ प्रिंसिपल ऑफ द पास्कल लॉ. यस, यू नो द पास्कल लॉ. जितना ज्यादा टाइम अपने को मिलता है उतना ही अपन उसमें कंसंट्रेशन, अटेंशन, फोकस अपना कम हो जाता है. इफ आई गिविंग द टाइम फॉर द murmur 3 days, then your speed of the reading is slow. If I'm giving you 1 hour for the murmur, your attention, focus, concentration is increases. So visualize yourself how you revise in last day of examination. Yes, just tomorrow is your examination, tomorrow is your final exam. One day before, how you revise, what is your speed, what is your speed. Yes, just visualize, just your next day is your exam. Yes, assume just next day is your exam and you have only one day, then think how you revise. So your speed automatically increases. Your speed automatically increases. तो यदि कल एग्जाम होता है तो कितना जल्दी जल्दी पढ़ते हैं, कैसे जल्दी जल्दी पेज को पलटते हैं, कैसे काम काम की चीजों को अपन देखते हुए चलते हैं, कैसे सरसरी नजरों से अपन देखते हुए चलते हैं. यदि एग्जाम कल हो तो उसी तरीके से पढ़ना है. एग्जाम कल ही है, आपको वही टाइम मिलने वाला है जितना अभी मिल रहा है, वैसे एनवायरनमेंट मिलने वाला है. सर आप क्या चूज करते, एक टॉपिक ध्यान से धीरे धीरे या फिर बहुत सारे टॉपिक कम टाइम में? सो इनिशियल रीडिंग यू हैव टू पुट योर टाइम, फॉर रिपीटेड रीडिंग यू हैव टू रिड्यूस योर टाइम। यस, काफी सारी चीजें बताई है। पढ़ते टाइम उसके क्वेश्चन बनाओ, पढ़ते टाइम उसको हाईलाइट करो, उसको फिल्टर करो, उसका कंसाइज नोट्स बनाओ, डेली का रिवीजन, डेली डेली आवर्स नोटबुक बनाओ, और उसके फ्लैश कार्ड बनाओ। खाना खाने से पहले, नहाने से पहले 5 फ्लैश कार्ड डेली रिवाइज करो। इतनी सारी चीजें यहाँ पे बताई गई है। यदि इसमें आपने से 5-10 चीजों को भी यूज में कर लिया तो काफी सारा एडवांटेज आपको होने वाला है। जस्ट इफ यू आर यूजिंग द 5 to 6 टेक्निक ऑफ 2 days सेशन, you will see dramatically improvement in your rank in just 1 month. Yes. So Dr. 7 JR7RD is asking how to do first revision and do subsequent revision with previous year topics. What should be ideal time in day to complete each revision cycle? So you don't have to invest too many time in the revision. जस्ट आपको स्पीडली पढ़ते जाना है, फटाफट से चैप्टर खोला, देखते गए पढ़ते गए। यस, ऐसा ही करना है। उसके बाद आपको उसका टेस्ट, जीटी, क्यूबिंग जो भी अटेंड करना है, उसमें जो भी क्वेश्चन आप गलत करो उसको वापस से आगे देखना है। यस, यू हैव टू स्टडी रैपिडली बाय दिस इंडेक्स फिंगर टेक्निक। जस्ट just scroll down your finger on the notes and keep reading and finish it in less possible time. After finishing, just attempt the test, or just do at the question book which I discussed earlier. Yes, quiz yourself and then again come to that topic. Yes, so now also tell how to have zero distraction while studying, especially the social media. So I already discussed, if you have a strong motivation, a strong why, if you have a strong question why you are preparing, yes, if you have positive affirmation, if you have visualizing yourself after your good result, if you are visualizing yourself after your dream branch, you will not distracted at all. You are distracting at this point because you have very weak motivation. You have very weak why. Yes, if you have a strong why, you cannot be distracted. Yes, खुद पे इतना कंट्रोल करना पड़ेगा. Yes, this is clear. So please note down on the page why you are preparing, why you are not doing job, why you are not earning at this point. Yes, please keep writing. Please write on the page. Yes, yes, please write on the page. Please note down on the page why you are preparing, why you are not earning. Yes, why you are not earning, why you are not doing job, why you are not marrying, why you are not watching the movies, why you are attending this session. Yes, why you are attending this session. Yes, and what is happening you after the bad results? Yes, what is happening you after the bad results, and how you visualize after the results, after your good rank? Keep writing this point. You can share this photograph also with me for the quantification. So if you are making this chart on yourself, you will not distracted. Yes, or is photograph ko keep these pages on your study table and keep looking at this table while why I am preparing. Yes, what is the strongest question for my preparation? So one strongest reason why I am not earning. Yes, you can earn 3,000 per day by the doing job, but you are not earning. You are preparing, so you are just investing your 3,000. Yes, so please understood the value of the time. Please understood the value of the time. Yes, so you have the positive affirmation, higher purpose, clarity of the purpose. Yes, positive reinforcement and visualization. Yes, so एक पेज पर लिख के रखेंगे the one strongest question for your preparation. Yes, and you can share with me also. Yes. Now, how to overcome self-doubt in facing the GT? Yes. Yes, tell me one thing.
you want to crack this neat PG, you want to get this good rank or not. If you want to get, you have to get in anyhow. Yes, anyhow, in any condition, by any circumstances, you get this good rank. Yes, even one attempt, two attempt, 100 attempt, your aim is to become a good ranker, a good college, good branch, and good seat. Yes, until you will not stop. Yes, so there is no point of about the self doubt. If you are, if you have consistency, if you are keeping yourself on track, if you are attempting GT in regular interval, if you are analyzing the content, if you are filtering the content, your score automatically improved after 10 GTs. After 10 GTs, so do not do any type of the self doubt. Even you got the negative answer, even you got the zero answer, please keep yourself on track. Yes, voice. There is a problem in voice. Yes. Please wait. Please wait. Yes, changing the Bluetooth speaker. Please wait.
No. Yes, voice is okay. Please comment about the voice. Yes, voice is okay. Sir, as said in live, we need to focus on important chapter like in pharma antimicrobial, like that can we share the important thing in all subject. Yes. So important thing is just if you are taking any ready-made list from any sources. Yes, if you are taking ready-made list for any sources of the important topic that are not helpful, you have to make this important topic list yourself. Just solve the previous year question module from the 2023 to 2018 and keep writing the topics. Yes, you can make this important topic list your own. Yes, if you are copying any important list from any sources, from any Instagram page, from any faculty, that is not helpful because they have written like respiratory volume and capacity. But how examiner question are asking, in which area the examiner are focusing, like in respiratory volume and capacity, they are focusing on the FRC. Every year there is a question on the FRC in the different manners, but you don't know this information when you copy the any important list. They just have to return respiratory volume and the capacity. They have not written, they have asked FRC. How they ask FRC in the diagram in IBQ? Yes, how the examiner correlating, how examiner are confusing you between option, how examiner making the clinical scenario, what confuser, what trap the examiner are using. So you have to make yourself, you have to make the list, important topic list for yourself. The step is just open the previous year question module from 2023 to 2018 subject wise. Just keep note down the topic on the pages, just keep down the topic on the pages, and also analyzing how examiner are asking. They are asking the images, clinical scenario, one liner. Yes, they are integrating one subject to another. Yes, if they are asking the psychiatry clinical scenario, pharmacology, drug, and they are asking about the receptors. Yes, so the examiner can link two subject, three subject. Yes, examiner can ask the extra pyramidal, examiner can give you extra pyramidal side effect clinical scenario, and they are giving one drug and they are asking the side effect of the drug, and they are asking the treatment of the side effect. So you will not know by this important topic list. So you have to make yourself, you have to make list for yourself. Yes. So just a सिंपल एक्सरसाइज, इससे आपको ये भी पता चल जाएगा कि एग्जाम में क्वेश्चन किस तरीके से आते हैं, कितने क्वेश्चन आते हैं, कौन से पार्ट से क्वेश्चन आते हैं. लाइक आई सेड द फार्माकोलॉजी हैज द मेजर जंक ऑफ द एंटीमाइक्रोबियल जनरल एंड साइकोफार्माकोलॉजी. बट अगेन फ्रॉम द एंटीमाइक्रोबियल, which uh, which chapter is important? Is HIV drug, is tubercular drug, is general antimicrobial is important? In tubercular drug, which drug they are asking? They are asking rifampicin. In rifampicin, which point they are asking? They are asking about the side effect. They are asking about the mechanism of action. Yes, so this point you will get familiar by the solving the previous year question only. No